crisis response in the city of Calgary. Both the Calgary Police Service and the city of Calgary announcing a reallocation of $16 million in funding to work on this ongoing and ever-changing service. Mara Grunau, the executive director of the Center for Suicide Prevention, joins me to talk about this new direction in the city. Mara, the pandemic has really hurt the mental health of people right across the globe. Can you set the stage as to what you're seeing right now in the city of Calgary?
More Canadians are reporting levels of unwellness. So more Canadians are self-reporting that they are feeling unwell mentally. And in Calgary, Distress Centre Calgary would be quick to tell you that their crisis calls have astronomically increased over the past year.
What is missing when it comes to our crisis response here in the city?
So it's a really good question. And the question is probably going to be answered differently depending on who you ask, because we're all different and people bring different things to the equation. And one person's crisis is unique from somebody else's. Their precipitating factors are different. So if we're talking about people at risk of suicide, people considering suicide, they will have one answer. If you're talking about people who are experiencing homelessness, who are unhoused at the time, their answer will be different. And one thing to note is that Calgary has changed a lot. We've grown. There's far more diversity in our population now. And there's all kinds of different stressors that people are experiencing in their lives that are new. Obviously COVID, but there's lots of other ones as well. If we think about the energy sector and where that has evolved to and the level of unemployment. So lots of different crisis services are needed.
When I hear that we need to have a real multifaceted approach, not just a one-size-fits-all response, especially if something is coming through the police or through our 911 emergency, calls, that we need to have a much greater breadth of the response tactics that we have.
Absolutely right, Tara. And I think our default has been to use the police, and the police are our bottom line, and they serve us 24/7, no matter what the crisis is. But I'm not in a position to speak for them, but I think the chief has been very clear that they're often called to things that aren't necessarily in their strongest suit, or not necessarily situations for which they've been trained. And they are looking to collaborate with other groups and other caregivers in our community so that people get the care that is the right care for them.
What was your reaction to the city of Calgary and Calgary Police Services announcing that they're reallocating $16 million to different programs within the city to better serve Calgarians?
I think it's bold, and I think it's groundbreaking. We are definitely setting a precedent that I imagine many other jurisdictions will follow. So it's exciting times in Calgary.
What else needs to happen when it comes to our programs and even research into effectively helping those in crisis?
Yeah, so that's a really good question. I think there are things we know right now, and if we talk to social agencies and 911 operators and the police, they can identify some significant gaps or strains on the system right off the bat. But what's really exciting is that the city is also allocating dollars to research to examine what is going on, what's working, what should we amplify, what used to work in the past, but we've maybe outgrown it, and where do new dollars or new foci need to be so that we can expand the system to best serve people.
Thanks so much for your time. Mara Grunau from the Center for Suicide Prevention.
Next